IBMS is proud to sponsor the AAH Awards for Biomedical Scientist of the Year to celebrate an exceptional biomedical scientist who has used their skills and expertise to advance practice in an innovative and impactful way, making a real difference to patients' lives and inspiring those around them. The shortlisted entrants for 2020 are Dr. Guy Orchard, Consultant Grade Biomedical Scientist at Biopath; Alison Watt, Biomedical Scientist and Ergonomist at Serious Hazards of Transfusion, or SHOT; Dr. Sarah Pitt, Principal Lecturer at the School of Pharmacy and Biomolecular Science, University of Brighton, and IBMS Chief Examiner in Virology.
Hi, my name is Guy Orchard. I'm a consultant grade biomedical scientist. I have worked on innovation projects over a decade now, and most specifically designing, trialling and developing and also manufacturing two products that have been patented for diagnostic use and have been widely used. The first one was about developing a new chemical that would assist in the softening of hard tissues like cartilage and nail, which are notoriously difficult to section and produce slides, microscopic slides from. I basically developed a new product that was less noxious and hazardous than many of the other products that were currently available. The second project was a piece of engineering. Now, I was keen to try to develop a dissection device that could be used at the cut-up bench when you're grossing tissues for histological analysis. Many of you will know that when you slice a loaf of bread, you're unable to cut accurately the thickness across the complete dimension of the loaf. This such produces quite a lot of inaccuracies and can contribute to poor performance in histological analysis. I got the idea for this because I was in a delicatessen watching a chap cut me some Parma ham, and I realised how accurate the Parma ham slices were within a few millimetres. But I wanted to go a bit further than that, make it even more accurate. So I started drawing sketches that looked a little bit like a guillotine, and how I produced the concept of accuracy was by taking a micrometer and attaching it to this guillotine-like device so that you could set it to a specific thickness and therefore guarantee thickness across a relatively wide dimension.
My name's Alison Watt. I'm part of the steering group for SHOT, which is the UK Haemovigilance Scheme. It stands for Serious Hazards of Transfusion. And as the name suggests, the aim of SHOT is to look at problems in transfusion and make recommendations to improve practice. My research is all about applying human factors to the transfusion process. And human factors is about the interaction of human beings with other elements in a system. And the main area of work that I've been doing is asking people a very simple question, which is, what is the biggest difficulty that you've had doing this job and how have you got around it? And what people do is they magically tell you what their problems are and all the adaptations that they've made to make those problems go away. And the next stage of that is to analyse what they tell you and look at whether they have dealt with the trigger of that problem, or have they done some kind of workaround, which is more likely the situation that happens with problems like that, so that they add an extra checking process or they do something that's not inherently safe. And by asking that very simple question in audits covering the whole of the transfusion process, we were able to show that in about 2/3 of cases, they don't solve the underlying problem. They just make some kind of workaround. And there are mechanisms when you can look at that and see whether that's going to be a safe outcome or is likely to be problems, i.e., as we said, an accident waiting to happen.
Hello, my name is Sarah Pitt and I'm a biomedical scientist. I specialise in virology, so I've had a very busy year doing COVID-19 related work. I'm a lecturer at the University of Brighton, where I see my role as developing the next generation of biomedical scientists. I'm also the Chief Virology Examiner for the Institute of Biomedical Science, so I'm helping people to develop their knowledge and expertise all throughout their careers. I was very surprised to be nominated for this award and absolutely stunned to be shortlisted, but I'm delighted because I'm very proud of being a biomedical scientist. The project that I've been working on has been looking at the antimicrobial properties of the mucus from the brown garden snail. These are the ones that have been eating all the lovely vegetables that you've been growing in your garden over the summer. We found in the laboratory that a preparation of the mucus inhibited the growth of a bacterium called Pseudomonas aeruginosa. This is a serious pathogen which causes respiratory infections, particularly in people with cystic fibrosis. And there are a lot of drug-resistant strains, so this finding could be very exciting. Thank you.
This category attracted strong entries and our shortlist was outstanding, but the winner caught the judge's eye for his innovative and impactful pathology products which will make a difference to everyday patient care. Congratulations to Biomedical Science of the Year 2020, Dr. Guy Orchard.